Thanks, John, for hosting us here today at Sparrow, and thanks for attending the regional kickoff for the HIP Michigan program. A new analysis by the federal government showed recently that up to 129 million Americans under the age of 65 have some type of pre-existing health condition. These may be things like heart disease, cancer, asthma, high blood pressure, or arthritis. Older Americans between the ages of 55 and 64 are particularly at risk, with up to 86% of those people in that age range living with a pre-existing condition. As many as 30% of people under age 65 who are in perfectly good health today are likely to develop a pre-existing health condition over the next 8 years. Up to 1 in 5 Americans under the age of 65 with a pre-existing condition, that's 25 million folks, are uninsured. And that's where the health insurance program for Michigan comes into play, otherwise known as HIP Michigan. If you know somebody who is unable to obtain insurance due to a pre-existing condition and who has been uninsured for at least the past 6 months, they need to know about the HIP Michigan program. HIP Michigan is accessible. The coverage is available to all Michigan citizens on a first-come, first-served basis. This is great news for residents who have been unable to obtain quality, affordable health insurance. HIP Michigan is affordable. For patients who can't get insurance today because they have a pre-existing health condition, HIP Michigan offers affordable health insurance coverage that can protect them from financial ruin in the face of big medical bills. Premiums for payments for the HIP Michigan program are very similar to what a person trying to obtain health insurance coverage would get who doesn't have a pre-existing health conditions. The premium costs do vary by age. In general, we expect that a HIP Michigan enrollee would pay somewhere between 25 to 30% of the total cost of the program. The key difference in the HIP Michigan program is that coverage for the pre-existing condition is included, and that's a real key, potentially life-saving issue for many people without health insurance. The premiums range for someone under the age of 24, under the age of 18, $170 to over $650 for someone over the age of 60. Co-pays for doctor's office visits range between $20 and $30. Emergency room visits would be $100. There is coverage for prescription drugs, and the co-pays range between $10 for generics and $30 to $50 for brand name medications. The HIP Michigan program does provide peace of mind. As I mentioned earlier, a monthly premium may range between $200 to $600, but the annual health care costs for the program are expected to be in the $25,000 a year range. So this is good return on investment for people looking to obtain health insurance. Because of HIP Michigan, many people today are able to obtain surgeries, doctor visits, preventive care visits, chemotherapy that had been long delayed because they were unable to pay for them or unable to obtain access to the system. As I mentioned, the program does provide comprehensive coverage. It's many, if not all, the same type of coverage that people would get through traditional employer-sponsored coverage. As I mentioned, it covers medical office visits, pharmacy services, emergency care, hospital coverage, home health care coverage, wellness visits, behavioral health services. So it's a very broad coverage. You can find providers all across the state, either through the PHP network or through a network known as Cofinity. And so there are hospitals and doctors in every county across the state. If you'd like more information about the program, you can go to hipmichigan.com, or you can call the HIP Michigan Customer Service toll-free number. That's 1-877-459-3113. It is a convenient program. We're here to help people apply. What I recommend is that everyone who thinks that this may be a program for you, make an application or call the 1-800 number to get more information about the program. There's been a number of situations where we've actually helped potential enrollees fill out the forms, and help them determine if they are qualified. The application process takes potentially up to 30 days, although right now we're able to turn around applications very quickly. Coverage does start at the first of the month, so if people can get that information earlier, we can hopefully get them up and running as quickly as possible. I would like to thank again John Berg and Sparrow for hosting us today, and then I would also like to thank the many partner organizations across the state of Michigan that have helped us, including Michigan Health and Hospital Association, members of the legislature that are here today, AARP of Michigan, Michigan Pharmacists Association, especially our colleagues at the